Hi there, it's Marsh from the Health and Wellbeing Group. Glorious day in Berlin. I hope it's nice where you are. I'd like to speak to you today on the subject of anxiety. And before I go on, I would ask people if it is that you've struggled or you know people who have struggled. Please, at the end of this, add in the comment section on if it is what worked for you and what has worked for others. A couple of facts to start off with, and that is in the United States, 18.1% of people, of adults, struggle with anxiety, yet only 37% of the 18.1% has been treated. In the UK, it's around the same figure, 18% of adults who struggle with anxiety, yet it's a much higher proportion that is treated. And if we look at the symptoms, struggling with anxiety can affect you both mentally and physically. Some people struggle with just one or two of the symptoms, yet others often more. You should see a doctor if it's affecting your daily life or causing distress. Psychological symptoms can include resentfulness or resentlessness, a sense of dread, feeling constantly on edge, difficulty concentrating, irritability. When suffering these symptoms, they can cause you to be withdrawn from social contact, including your friends and family, as you wish to avoid feelings of dread and worry. Even going to work becomes a struggle and may result in you having time off sick. You might even worry even more when you're off sick than it is in going to work, and from that you can get a great deal of a lack of self-esteem. Physical symptoms, they can include dizziness, tiredness, a noticeably strong, fast or irregular heartbeat or palpitations you may say, muscle aches and tensions, trembling and shaking, a dry mouth, stomach aches, feeling sick, headaches, pins and needles, difficulty in falling asleep or indeed staying asleep, and at the end of the day, insomnia. There are triggers within anxiety, and if it is you get anxious of a specific phobia, you'll usually know what causes it, such as like claustrophobia. You will know that being in a confined area will trigger your anxiety. However, it may not be so clear what you're anxious about on other issues. And not knowing is what can trigger your anxiety. It can intensify it. You might then worry that there's no solution. Now, when it comes to a diagnosis, again, see your doctor. If the anxiety is affecting your daily life or causing distress, anxiety can be a difficult issue to diagnose. It can sometimes become hard to diagnose from other mental health issues, such as depression. You may have anxiety if the worrying affects your daily life, including your life and subject and social life. Your worries could be extremely stressful and upsetting. You tend to worry about all sorts of issues, and you always need to think of the worst possible scenario. Your worrying can be controllable. You will have felt worried nearly every day for about 6 months, and you know that's when the doctor will easily get involved. But your worrying can be controlled. Talking to your GP about your anxiety, it may ask you questions and ascertain any physical or psychological symptoms. And how long have you had them for? It'll dig deep to find out your worries, fears and emotions and your personal life. You may find it difficult to talk about such matters, but the doctor must be able to understand both the symptoms and circumstances to formulate the correct diagnosis. You're in all probability to be diagnosed with anxiety if it is that you've had the symptoms for 6 months or longer. If it is, and you find it difficult to manage your feelings of anxiety, that in itself may be an indication that you have the condition. To help out with the diagnosis, the doctor may carry out a physical examination or blood test. For other conditions that he might be looking for, such as anemia and overactive thyroid, they can also cause symptoms similar to that of the anxiety. So he'll try and wade past them or exclude them before he's convinced that you're struggling with anxiety. Anxiety is a long-term condition, but the treatments can be for short terms and long terms, and there are a different number of treatments that can help. If you have been diagnosed with anxiety, it's normal to be treated with psychological treatment before prescribed medication. You can also get psychological therapies like cognitive behavioural therapy and applied relaxation on the NHS, and you don't need a referral from a GP to get that. You can refer yourself directly to a psychological therapist service, and CBT is one of the most effective treatments for anxiety. Studies of different treatments for anxiety have found the benefits last longer than those of medication. Having said that, there's no single treatment that works for everyone the same. CBT helps you to question your negative or anxious thoughts, and to do things you usually avoid. They make you I'll say that again. And to do the things that you usually avoid because they make you anxious, this helps you to control it. It usually involves meeting with a specialist or trained accredited therapist, of which there aren't many. And that treatment will be usually an hour long, every 3 or 4 weeks, for around 3 months. Applied relaxation. This focuses on relaxing your muscles in a particular way during situations that usually causes the anxiety. This technique needs to be taught by a trained therapist, but normally entails learning how to relax your muscles. Also learning to relax your muscles quickly in a response to a trigger. That word as an example can be just simple as relax. Practice relaxing your muscles in situations that make you anxious. As with CBT, excuse me, applied relaxation therapy will usually mean meeting a therapist for a 1-hour session every week for around 3 to 4 months. Medication. If psychological treatments don't help, or you don't wish to try them normally when you're offered them, or offered the medication I should say, and again there are many choices of medication, some are designed for short term and some for longer periods. The level of a chemical within your brain called serotonin. Other medicines will be available such as pregabalin, which is also an anticonvulsant, but being found out to help people with anxiety. It's a drug what they usually give to people who suffer with epilepsy. Benzodiazepines, a type of sedative. Again, your doctor will prescribe for either short term or long term and the level of anxiety that you've got. Some of these drugs have many effects and can be also addictive. Some may include no intake of alcohol, no driving, avoid using machinery, and all I will say is ensure that you have the discussion with your doctor on these side effects. And of course some of them are addictive. And referral to a specialist. If you have the treatments mentioned and have significant symptoms of anxiety, You may wish to discuss this subject with your doctor, whether or not you should be referred to a mental health specialist. If it is, you live in the UK, there's a good chance you will get referred. And within this mental health team, there's usually one in every community, which include a range of specialists comprising of psychiatrists, psychiatric nurse, clinical nurses, occupational therapists, social workers, and an appropriate specialist will carry out a reassessment of your condition. They will ask you questions again about your previous treatments and how effective you found it. Also, they will cover a lot of the same ground that you spoke to about with your doctor. What affects your condition? Ascertain what support you get from your family and friends, if any. And from this, they may suggest an alternative treatment or treatments. Again, you may be offered both psychological treatments with medications or more than one medication. What I will say from this, there are a number of self-helps as well that one can try. You could try a book online, an online course, which can help you to cope with your anxiety. Other self-helps include exercise regularly. This can help you to combat stress and receive or relieve tension. It also encourages the brain to release serotonin, which can improve your mood. Aerobic exercise can be helpful in particular. Examples can be such as walking fast, jogging, swimming, cycling, tennis, football, rugby, and of course playing aerobics seems to be very effective. It is suggested that you aim for something around 150 minutes a week, of this exercise, of what they call a moderate intensity. And that is something that's going to work hard enough, if you wish, to raise your heartbeat and make you breathe faster. And as important as exercising is learn to relax. As well as exercise, it is important. As well as exercising, learning to relax, maybe try breathing relaxation methods. There's plenty on the internet. Exercises can be helpful. Other activities such as yoga or pilates can help you to unwind. You can try to listen to anxiety training audios online. There are talks about how to relax and beat your anxieties, both short term and long term. And again, helping yourself avoid caffeine. This can make you more anxious than normal. It can both disturb your sleep and speed up your heartbeat. Now the caffeine, we're talking drinks of coffee, tea, fizzy drinks and energy drinks. Try to cut them out. Avoid smoking and drinking. This is proven to make anxiety worse. Only try to drink in moderation. If it is that you do have to drink, try up to 14 units a week, which is in the UK no more than 6 pints, and over a 3-day period. So I suppose don't aim for more than 2 pints in any one session. And like I say, spread it over a 3-day. Now there are a number of support groups that you can contact, and it is a good way to manage your anxiety and to meet others with similar experiences. The 3 major groups are Anxiety UK, Mind and Rethink Mental Illness Group. Some groups can offer support over the phone or indeed writing. You can ask your GP for help with this or simply look them up online. If you go into the NHS online and look at mental health support. Having said that, I will stick on a number of contactable groups on the end of the video. I shall pin it to the message. all that remains from me is a good afternoon from me. I hope some of it's been enlightening for people who struggle with this, and indeed that other people have a greater understanding. Yeah. Good afternoon, and hope that yourself and all your loved ones have a great healthy and well-being time. Bye for now. Oh, must say, if it is that you thought of anything that helps you, don't forget to add it into the comments. Okay, bye for now.